Hi everybody, Jen here. So OCD Action is a charity established in 1994 offering support, information and advocacy services, CPD and other courses with the aim to increase awareness of OCD in learners, help educators spot the signs of OCD, guide teachers in facilitating learners for these people, and to provide support for learners and their families. So what is OCD? Have you ever worried about something? Is there a little niggling feeling in the back of your mind? Are you thinking about something? Have you locked the door? Have you turned off the eye and things like this? Everyone experiences anxiety, and OCD is a spectrum that we are all on. The only difference between you and I is the degree of anxiety that I suffer. For someone with OCD, this little niggling voice in the back of their head is persistent and becomes an unwanted obsession. This anxiety that people with OCD feel becomes very distressing. It grows and grows, it's very time-consuming, and it therefore interferes with many aspects of life, such as socialising, family life, academic performance, and so forth. There are questions into: is OCD inherent or learned? We don't know the answer to that. There are arguments for both cases, but we do know that it's linked to other special educational needs, such as autism. Obsessions often trigger compulsions, and we use these compulsions to counteract the anxiety that we feel from our OCD. Some of these compulsions are repetitive behaviours to reduce the distress caused by the obsession. So, common obsessions that people with OCD experience are fears about dirt and contamination, unwanted sexual thoughts, worries about harm coming to yourself or others, discomfort if things are not symmetrical or even, fearful of losing important things, intrusive, frequent, and unwanted images, thoughts, or ideas. All of these obsessions cause the person with OCD anxiety. My own OCD is a germ phobia, which I have coined the term raging germ phobia, because it literally dominates my thoughts about 90% of the time. So every time I look at a surface or a door handle, for example, I can literally visualise the bacteria on these surfaces. To combat the anxiety I feel when I'm getting stressed out about germs, I carry out actions that are known as compulsions. These, for me personally, are such things as washing my hands, using antibacterial hand gels, using Dettol wipes on every surface, not touching door handles, not sharing pens in class. Also, if we're passing out books, I don't want to touch the books that are being passed out around the students, so I get one of my students to pass out the book. All these actions that I take are counteracting the anxiety that I'm feeling by the germ phobia that I'm suffering from. Other compulsions that people with OCD engage in to reduce the levels of anxiety in order to counteract the stress are sorts of behaviours to reduce the anxiety that they're feeling, such as they check things over and over, touch or tap, count things, they hoard things, collect things, repeated washing and cleaning, redoing jobs. A common one you'll see in the classroom is you'll get a student that is continually seeking reassurance. So there might be questions such as, Miss, shall I put my name there? Shall I do this? Is this the right page? Is this the question I'm supposed to be answering now? Is this the monologue I'm supposed to be reading from? And it can come across to someone who doesn't know what they're looking for, that this is a needy student, maybe acting out, maybe attention seeking. But this is not what this is for students with OCD. This is anxiety about wanting to please and not wanting to carry on and do something if it's the wrong thing, and so they constantly seek reassurance as a way of reducing the anxiety they're feeling about sort of performance anxiety. So if any of you have experienced students that seem to ask a lot of questions and continually need reassurance and continually need positive encouragement, then you might be able to have a think about if possibly they might have an OCD. These compulsions or rituals can take up a huge amount of time each day, and they impact on what society considers acceptable behaviour. So I can't, for example, hold open a door for somebody because I can't touch a door. So I have to stand at the doorway and wait for someone else to hold it open for me. So obviously that could be considered rude on my part. People with OCD, usually but not always, recognise the irrationality and excessiveness of their obsessions. For example, today it took me 3.5 hours to get out of the house because I was having a particularly bad morning with my germ phobia, and I had to keep washing my hands, and then I didn't think the fresh clothes that I'd just got out of the wardrobe and put on were clean, so I had to change into a different outfit, and then I had to wash my hands again, and then I got worried about the washing up in the bowl, so I had to do that before I left the house. So you can see, if I'm giving you that as an example of grown-up behaviour, you can see how children who can't rationalise their instincts and their behaviours would have a much more difficult time of it in expressing their anxieties, and would have a much more difficult time of getting strangers or teachers to understand why they're behaving in the way that they're behaving. This is obviously very frustrating for the person suffering from the OCD. OCD affects up to 3% of the population. It's estimated that there are 130,000 children in mainstream education right now and rising that suffer from some form of OCD. Diagnosis of OCD is increasing as the medical profession develops their understanding of the condition. You will encounter students with OCD in your lessons, and it's up to you as a professional to be able to identify that that is a student with OCD and then take the necessary steps. People with OCD are often embarrassed by their symptoms, which is why OCD is often called the secret disorder. People with OCD will keep their anxieties quiet, feeling that maybe they're going crazy, or maybe they're a bit freaky, all these kinds of derogative words that society associates with people with mental health issues. Because it's kept as a secret disorder, many people are not diagnosed at all. So the important thing for you as teachers and practitioners is to pick up some points about how to identify OCD in your learners. For this, you obviously need to have an understanding of what an OCD might look like. The only way you're going to be able to judge if your learners have an OCD is by knowing your learners and watching for changes in their behaviour, or watching for patterns of behaviour that don't seem to fit. As with all good teaching, we need to know our learners in order to provide an inclusive education for them, and this is really just an extension of that. You also need to liaise with parents and colleagues, and the ultimate step is a formal diagnosis by a healthcare professional or GP. So really the lines of communication are the most important thing. If you think of a triangle, you are one point, the parents are the other point, and healthcare professionals are the third point. So it's school, parents and healthcare professionals, and in the middle of that triangle is the learner. So those three agents need to be acting to support the learner. Possible signs of OCD at school, so things you need to be looking out for in your students, is poor attention. This could come from extreme tiredness. Students that have to sit up for hours in the evening counting or tapping things, or reorganising the CDs on their shelves, or cleaning their shoes over and over again. All these things are obviously exhausting, and so when students come to school, they might be very tired, and therefore their attention is going to suffer. Students that are asking frequently to go to the toilet, or when they do go to the toilet, they're away for a long time. This might not be them just driving off and trying to skip out of class. This might be, as is in my case, when I'm washing my hands. It takes me a good 10 minutes to wash my hands thoroughly. If you wash your hands once, if you have a germ phobia, logically your hand is clean, but you cannot stop washing it until the little voice in your head says, okay, your hand is clean now. So I can wash my hands once with antibacterial soap, and I know that that hand is clean, but I will continue to wash my hands for the next 9 minutes until my OCD says to me, literally in a voice, that's fine now, and then I can leave. Also, other signs of OCD in your students might be inability to touch objects. For example, I can't share textbooks with my students. If you see something being handed to a student and they're reluctant to take them, that could be a sign. The excessive questioning, as we just spoke about, possibly isn't just a needy student. It could be a sign of OCD. Messy work is another sign. An example that their homework will come in and be very messy and or crumpled up, or you can see that they've screwed it up and then tried to flatten it out, or it's got lots of crosses marked out of it, or lots of pipettes, things like this. So what comes across as messy to you is actually something that the student has struggled to produce this piece of homework. You can literally see, if you're looking at some paperwork that a student has handed in, you can see the anxiety that they've had with these bits of paper. So you can see the really hard scribbling out where the pen's gone through the paper because they can't stand for that bad word, in comments, to exist on that paper. So they've scribbled it out to the point that the pen goes through the paper. Lateness and missed deadlines. Again, if the students are up late every night acting out their compulsions in order to diffuse their anxiety, they're not going to be getting the sleep that they need. So they'll be late into class, they won't get their homework done. All these things obviously are impacted on by the compulsions that the students carry out to combat their anxiety. Aligning items on a desk, if everything has to be symmetrical and even and a balance on the desk, 2 books on one side, 2 books on the other, and the pens all lined up nicely, you know, that might not just be a sign of someone who's neat, that might be a sign of possibly having an OCD. Repetitive behaviours are a very common sign in learners of having an OCD. If there's lots of standing up and sitting down, or lots of fiddling with the blinds, opening and closing the windows, things like that, things that come across in an everyday classroom as a child acting a little bit naughty, there could be very good reasons for them. Sometimes an OCD will become apparent in the learner if the learner has difficulty making decisions. They, for example, will be fearful of choosing the wrong thing. Therefore, they'll not want to put all their eggs in one basket, so to speak, and make a decision for fear of being wrong. So they'd rather make no decision at all than make the wrong one. Fairly common in students with OCD is low self-esteem, and as a knock-on effect from that, there's difficulty with peer relationships. Obviously, all of these compulsions take time to carry out, and therefore the decline in school performance is quite usual. Avoidance of areas in schools or certain lessons, for example, a student could become obsessed with, just off the top of my head, thinking that the beakers in the science lab are contaminated, they would therefore avoid the science lab. Or when I was at university, for example, I couldn't go into the university library and borrow books because I would be thinking of everyone else who had touched those books. So it's hugely detrimental to my own university research. I couldn't borrow the books in the library. So even though I knew I needed to go in there and use these books, I literally couldn't do it. So even though these students know they have to go into these rooms or sit at this desk or read that textbook, even though they know it's fundamental, sometimes they just can't do it. So as a teacher, you need to be aware that maybe that's not them misbehaving, maybe that's a symptom of something else. Social difficulties at school include unwilling to be near others due to contamination fears. For example, I don't cuddle anyone, not even my mother. Avoiding social situations due to embarrassment. They may have difficulty maintaining friendships due to avoiding social events. They also risk appearing odd, and because of that, they may be bullied by their peers. You know what kids are like, they're the first to pick up on any differences between themselves and others. So if there's a child being picked on, it may be a sign that, that the student body in general is thinking that something in brackets failed with that student. How can teachers help? Well, you play a major role. It's your job to identify learners who may have OCD, because in schools you see your students probably more than the parents do during the week, so you're the main grown-up in their lives, so to speak. Obviously, in terms of pedagogy, it's your job to provide appropriate support in lessons and facilitate learning for these students. It's important to share concerns with parents, and you must liaise with colleagues, senseis, and other stakeholders. The step on from that would be to get the student statemented, and that would be through your senko. Progress is more likely if you are able to work with the learner, parents, and therapists to agree when to accommodate and when not to indulge the compulsion. For example, if a student has to go out of the room 3 or 4 times during your lesson to wash their hands, maybe you could negotiate with them that it gets reduced. So instead of going out 5 times in the lesson, okay, let's try to stick to going out 3 times in the lesson. So it's up to you to liaise and try and reach some kind of compromise with the student. But you cannot force them. You cannot force them to cold turkey quit their compulsions, because that's going to have a detrimental effect on their mental health. What else can the school do? The first one, the biggest one, be patient and understanding. Liaise with the parents and therapists. Identify a sign or a secret code. Allow the learner to take a short break if anxiety is getting too much and they're getting stressed. Rather than keep them in that anxious and stressful situation, allow them to leave the room or go and wash their hands if that's what it's about, or go and get a drink if that's what it's about, or stand up and sit down if that's what it's about. Designate a mentor, apply for special measures and exams. That's quite important, because if a student has a counting compulsion, they may be counting up their pens during the exam when everybody else is writing, so you can apply for extra time. May extend the assignment deadlines and decrease the workload. This is something to talk about with the student and parents, and also your head of department. Help them focus on strengths and achieve their goals. Watch out for signs of bullying, and facilitate a classroom discussion about OCD so that the students' peers are aware of what's going on, and that will make the environment much easier for the student with OCD to take this. There's no single one-fits-all way to manage OCDs or related behaviours in learners. Each case and treatment path is unique, and the only way to address any of this is to liaise and communicate. You can't control your learner's behaviour, and you can't attempt to impose management on that behaviour. It's up to the learner to do it, but it's your job to facilitate this. You can, however, control your own responses and behaviours, and obviously, as all good teachers you should not judge or label. You must be patient and communicate and practice inclusivity. Accommodate the compulsions and the OCD, but don't indulge. You can speak to the personal tutor or the senko or a therapist to figure out at what point you should accommodate and at what point it's overindulgent. OCD hinders learning by distracting the learner. You must negate this distraction as best you can to do your job, which is facilitate learning and progress. I'd like to hand over to India now. She's in year 13, planning to study psychology at uni. She suffered from OCD for 4 or 5 years and has undertaken CBT. She runs a psychology society at school and works to raise awareness of mental health.
But I think everyone should be able to hear me okay. So like Jen introduced me, I'm kind of, I'm in the middle of doing my A-levels at 6th form, but I've had my OCD for the last kind of 4 to 5 years, but it's taken various forms, and it's mainly because at the moment it's kind of more as a result of my exams. It's a bit more stressful, so I'm a bit more anxious, but I'm kind of working a lot with kind of some people at school with my psychology society to try and increase awareness of OCD in school, because I've been very lucky. I've had my the head of sixth form and my head of college are well aware of my OCD and my anxieties, and I'm lucky I can go and speak to them about it when I would like to. But because they're lucky and they have an understanding about it, they're very approachable and I can talk to them about it. And I've had increased deadlines for things, and I haven't had they've kind of reduced my workload occasionally, and it's been great. But I have come across other teachers as well who haven't been as understanding, and cases where they've kind of brought up the kind of traditional stereotypes of OCD and the idea that this is kind of cleaning disorder or whatever. So me and my psychology society that we run, we're kind of working on targeting kind of these kind of teachers and just trying to increase awareness in general, because from what we've done already, we've kind of hoping to run these assemblies, but just kind of having our society set up, people have come up to me and come forward to the society and said, look, I think I'm suffering from OCD and wanted to find out a bit more about treatment. And I don't know if you know about cognitive behavioural therapy, but it's quite a well-known treatment for OCD sufferers, and it's basically kind of targeting the cognitive part of your brain, which is kind of bringing up these thoughts and intrusive thoughts, and you instead of having them developing, you kind of talk through to your therapist, and you use the information, and you make these kind of help patients identify these faulty thoughts and then help to correct them. And so, for example, I've always kind of had a problem with anxiety and stress, and in my therapist, and I've kind of worked through techniques that help me kind of overcome kind of the physiological feelings of stress, like relaxation. And it's all about targeting the current thought. That's just what I've undertaken. But in terms of this psychology society, people have come forward to us, and we're going to hopefully run these assemblies. And in a couple of weeks, me and another girl who also volunteers at OCD Action on the youth leadership panel called Esme, we're hoping to do a Tuesday talk to some of the teachers at my school again, because we're just really keen to kind of just encourage increasing awareness and the fact that OCD and stress and anxiety is increasingly prevalent among teenagers these days. But yeah, that's kind of what I'm working on. But like I said, it has been great that I've had teachers that I can speak to. But what they've done is that I've been able to talk to them about it, and they've kind of increased their knowledge about it. And a lot of other people have come forward as well and said, but I'm hoping to kind of continue to raise awareness. But it hasn't been easy, I have to say, having OCD and being a sixth form, because it is very stressful and it is hard. But actually, yeah, I know that I have that support base there, and that they are very more willing to help me out. And that's kind of that area of OCD at school. But interestingly, I just briefly mentioned that I did a project about causes of OCD in teenagers for one of my AS levels last year, and that kind of helped. I also did a presentation about that to some of the leadership team at my school, and again that worked to really help raise awareness, and they've kind of helped improve understanding about OCD in school. And I really enjoyed writing the project because that kind of gave me a greater insight into the causes of the disorder. And yeah, I found that if they would like a copy of it, I'm more than happy to send it over, because I go into quite a lot of detail about the biological and psychological explanations. Because interestingly for me, I have a twin sister, but she has not developed OCD. So that was quite an insightful project for me.